So hello friend, I'm Ankur and you are watching my channel Techno Health. So today we will discuss about an Ambu bag. This is an Ambu bag and it is a medical device mostly used in emergency and non-emergency situation. So what is an Ambu bag? An Ambu bag, also known as a manual resuscitator or BVM, that is bag wall mask. It is a device used to provide the respiratory support to a patient in emergency or a non-emergency situation. It consists of a self-inflating bag, a mask, a mouthpiece, and a valve, and two air inlet. Now, what is AMBU stand for? That is the Artificial Manual Breathing Unit. This is a AMBU. AMBU means Artificial Manual Breathing Unit. So, what is the use of AMBU bag? One of the primary use of an AMBU bag is resuscitation in emergency situation such as cardiac arrest, and it can also be used to provide respiratory support to the patient who are unable to breathe on their own, either temporarily or on a long-term basis. The Ambu bag can also be used to maintain the airway patency, for example, in case of severe asthma attack or allergy reactions. So, how does an Ambu bag work? So, I'm a user and I will manually squeeze the bag to deliver breeze to the patient. That's like this. I'm squeezing the bag and it will deliver air, oxygen to the patient through the mask or mouthpiece. So this is a mouthpiece, and if I attach a mask on it, then I am going to deliver air to the patient with this mask. And this is a pressure release valve, and this valve allows to control the flow of the air and the amount of the pressure applied. Ambu bag can also be used on patient of all age from newborn to adult. So what are the advantages of this Ambu bag? There are several advantages to use an Ambu bag. One of the main benefits of this Ambu bag is it is portable and easy to use, making it suitable for use in variety of the settings, including the hospitals, ambulance, emergency care unit, and it is also a useful tool to have on hand in case of emergency, as it can provide life-saving support to the patients until more advanced medical care is available. So, in conclusion, an Ambu bag is a crucial device used to provide the respiratory support to the patient in emergency and a non-emergency situation. It is portable, easy to use, and can be used to the patient of all ages. It is important to have an Ambu bag on hand in case of emergency, as it can potentially save the life. We can use it a tracheostomy whenever TT tube. We can add a connector to this tracheostomy tube, and we can give artificial breathing by squeezing this bag like this. But we have to show that only the trained healthcare professional should use an Ambu bag on the patient with a tracheostomy. It is also essential to follow the proper infection control protocols to prevent the spread of the disease or nosocomial infections. Proper use of Ambu bag can help to maintain airway patency and provide vital respiratory support to the patient with a tracheostomy. So, how to clean this Ambu bag after use? So, we can use a glutaraldehyde 2% solution to clean this Ambu bag. We can dip this Ambu bag to the glutaraldehyde 2% solution to clean it, so that we can be sure that this Ambu bag is totally free from infection. And we can also clean this mask with the 2% glutaraldehyde solution. 2% glutaraldehyde solution is a disinfectant, so we can use it to sterile this Ambu bag and its part. So, if we have a glutaraldehyde 2% solution and we will dip these parts, these instruments, we can open it like this and disassemble from here and dip it in 2% glutaraldehyde solution, so that we can sure that it is sterile and we can use it again in other patient. So this was the Ambu bag. I hope you will like this video. I would like to tell the part of this Ambu bag. This is mask, face mask, and this is the mouthpiece. This is pressure release valve. This is self-inflating bag, and this is inlet, two inlet, and this is for the O2 reservoir, and this is a pressure release valve. This is also a release valve. Okay, this is for air reservoir. This is for O2 cylinder. We can fix a tube. and attached with the O2 cylinder, so that we can get oxygen from this point. And this is a self-inflating bag, pressure release valve. This is a mouthpiece. It is a one-way mask. Whenever I am squeezing it, you can see this orange piece, fish mouth. It's acting like fish mouth. As a fish breathe, it's acting like this only, fish mouth. So it is a one-way valve. So we can only give air, oxygen to the patient